Right now, someone on Earth gets a headache every single second. It is one of the most universal human experiences. But here's the thing, not all headaches are the same. Each one has a different origin, a different mechanism, a different story. This is every major headache type explained. The tension headache is the most common headache on the planet. Around 40% of people will have one at some point in their life. It feels like a tight band wrapped around your skull, pressure on both sides, dull, steady, not pulsing. Here is what is actually happening. The muscles around your scalp, neck, and jaw contract. That contraction puts mechanical pressure on pain-sensitive nerves in the head. Think of it like squeezing a hose. The pressure builds up and radiates outward. Researchers believe the trigeminal nerve, which covers most of the face and scalp, becomes sensitized during these episodes. The brain starts amplifying signals that it would normally ignore. Tension headaches last anywhere from 30 minutes to several hours. They are uncomfortable, but they are not dangerous. They do not come with nausea. They do not get worse with movement. They are the body telling you something, usually that you have been still, stressed, or stiff for too long. Migraine is in a completely different category. It is not just a bad headache. It is a neurological event. The pain is usually on one side of the head. It pulses. It throbs. Light and sound become unbearable. Many people experience nausea. Some vomit. About 1 in 3 people get an aura, visual disturbances, blind spots, or tingling, before the pain even starts. What causes this? The brain itself becomes electrically unstable. A wave of altered nerve activity, called cortical spreading depression, sweeps across the brain surface. This triggers the release of inflammatory chemicals around the blood vessels of the brain. Those vessels dilate. The pain receptors fire. The trigeminal nerve, again, plays a central role. It carries pain signals from the face and scalp directly into the brain. Migraines can last 4 to 72 hours. They are debilitating for roughly 15% of the global population. The World Health Organization ranks severe migraine among the top 20 most disabling medical conditions on Earth. If migraine is a storm, cluster headache is a lightning strike. The pain is described as one of the most intense experiences a human can endure. It hits on one side, usually around or behind one eye. It is sharp, burning, and relentless. And it comes in clusters, attacks that repeat daily, sometimes multiple times a day, for weeks or months. Then they disappear, sometimes for years. The hypothalamus is at the center of this. The hypothalamus controls the body's internal clock, and in cluster headache patients, it becomes abnormally active. It triggers the trigeminal nerve and the autonomic nervous system simultaneously. That is why, during an attack, the eye on the affected side often turns red and waters. The nostril on that side can block or run. The eyelid may droop. These are not side effects. They are direct outputs of the same neurological circuit misfiring. Cluster headaches affect less than 1% of the population, but for those who experience them, they are life-altering. When you are congested and your face hurts, it feels obvious. Sinus headache. But here is what research actually shows. True sinus headaches, caused by bacterial sinusitis, are far less common than most people think. Studies suggest that up to 90% of self-diagnosed sinus headaches are actually migraines. The symptoms overlap significantly: facial pressure, nasal congestion, pain that worsens when bending forward. A genuine sinus headache happens when the sinuses, the hollow spaces in your skull around the nose, become inflamed and filled with fluid. That fluid creates pressure. The pressure pushes against the walls of the sinus cavities. Those walls are lined with pain-sensitive tissue. The pain tends to be concentrated in the forehead, cheeks, and bridge of the nose. It typically comes alongside fever, thick discolored mucus, and a reduced sense of smell. Without those markers, what you are calling a sinus headache is probably something else. Water makes up about 75% of brain tissue. When you are dehydrated, the brain literally shrinks slightly. It pulls away from the skull. This stretches the pain-sensitive membrane surrounding the brain, called the meninges. That stretching is what you feel. The pain is usually across the forehead or the back of the head. It worsens when you stand up and eases slightly when you lie down. That position sensitivity is a key clue. Dehydration also reduces blood volume. Less blood means less oxygen delivery to the brain. The brain responds by dilating its blood vessels to compensate. That dilation itself can trigger pain. The fix is simple, but the speed matters. Drinking water rehydrates the meninges within 30 minutes to 3 hours. Electrolytes help the body absorb and retain that water more effectively. This is one of the most preventable headaches that exists. Caffeine is the most widely consumed psychoactive substance in the world. It works by blocking adenosine receptors in the brain. Adenosine is a chemical that builds up throughout the day and makes you feel sleepy. By blocking it, caffeine keeps you alert. But over time, the brain compensates. It grows more adenosine receptors to counteract the blockade. Now you need caffeine just to feel normal. When you stop caffeine, or simply delay your usual cup, adenosine floods all those extra receptors at once. Blood vessels in the brain dilate rapidly. That sudden dilation is the headache, throbbing, usually at the front of the head, and often accompanied by fatigue and difficulty concentrating. It typically starts 12 to 24 hours after your last dose. It peaks around 20 to 51 hours. It resolves within a week as the brain readjusts. Gradual reduction prevents it almost entirely. Eye strain headache. Staring at a screen for hours does not damage your eyes, but it does cause headaches, and here is the mechanism. When you focus on a screen, your eye muscles contract to adjust the lens for near vision. When those muscles are held in the same contracted position for extended periods, they fatigue. The strain radiates to the muscles surrounding the eye socket and the forehead. There is also a blinking factor. The average person blinks 15 to 20 times per minute. During screen use, that drops to 5 to 7 times per minute. Dry eyes send their own irritation signals to the brain, compounding the discomfort. The pain is usually a dull ache behind the eyes or across the forehead. It often develops slowly and builds over the course of a long work session. The 20-20-20 rule addresses this. Every 20 minutes, look at something 20 feet away for 20 seconds. It gives the eye muscles a moment to relax their contraction. Stress-related headache. Stress activates the body's fight-or-flight response. Adrenaline and cortisol flood the system. Heart rate increases. Muscles tighten. The muscles of the neck, shoulders, and scalp are particularly sensitive to this. Sustained tension in these muscles restricts blood flow and presses on nerves. The result is usually a tension-type headache, but the driver is purely psychological load. There is also a central sensitization component. Chronic stress lowers the brain's pain threshold. The nervous system becomes more reactive over time. Signals that would not normally register as pain begin to hurt. This is why people under long-term stress often report more frequent and more intense headaches. The system is already primed to amplify. Stress headaches are also bidirectional. The headache itself becomes a stressor, which feeds the cycle. Sleep-related headache. Sleep and headache have a complicated relationship. Too little sleep causes headaches, so does too much. During sleep deprivation, the body's pain modulation systems weaken. the brain produces less of the natural chemicals that suppress pain signals. Inflammation markers increase. Sensitivity rises. Too much sleep disrupts the brain's serotonin regulation. Serotonin plays a key role in blood vessel tone and pain processing. Sleeping in on weekends is a recognized trigger for Sunday morning migraines in susceptible people. There is also a structural overlap between sleep and headache disorders. The same brain regions, the hypothalamus, the brainstem, regulate both sleep cycles and headache initiation. Disrupting one almost inevitably affects the other. Consistent sleep timing, rather than total hours alone, appears to be the most protective factor. Every headache you have ever felt had a reason. Tension headaches come from muscle contraction and nerve sensitization. Migraines are neurological events involving cortical waves and blood vessel dilation. Cluster headaches originate in a misfiring hypothalamus. Sinus headaches require actual sinus inflammation to be real. Most are migraines in disguise. Dehydration shrinks the brain's cushioning and dilates its vessels. Caffeine withdrawal floods adenosine receptors all at once. Eye strain fatigues the muscles that focus your lens. Stress tightens everything and lowers your pain threshold. And sleep disruption removes the brain's ability to suppress pain at all. Every headache is a signal. The question is always, what is the system trying to tell you?